A lot of people do frictions dry. I'm quite happy to use oil as a base. I spend quite a while just coming in, finding the areas, and then when I get onto the epicondyle and I want to do cross-transverse frictions, then I start locating. And if you find it's a bit oily, just grab a bit of tissue cloth and then I just dry frictions across. But I also believe that frictions work just as well by coming in and frictioning along the line there. I tend to play with the wrist a little bit just to open her up. Sometimes slightly more tensioned and sometimes slightly less tensioned. You get a little bit deeper if you take a bit of tension off. Sometimes you block where you need to get if you over tension the tissue. In terms of the epicondyle, so I get my finger on the epicondyle, come in much tighter, aim at, and then I use my finger to stabilise the needle, making sure I don't touch the needle in any shape or form. Get my first angle right, otherwise you're fighting against it, and then we should just make contact with the bone there, and now we're just gently fenestrating. That's that typical real response, and there's a really thick bit there.
Bit sharp that one.
Okay, almost through. There we go, and I'm through some thickened tissue.
Oh, I'm starting. I can edit it, it's fine.
Epicondyle, main flexor line. Got to be a little bit careful, you'll catch the nerve here, the ulnar nerve as you needle in. So I tend to stay away from this little area here. As the nerve comes out of the groove at the back, it tends to just spin and fan a bit there. Line in for true medial epicondyle pain, and line there for IMS, pronator and just scar tissue. So sometimes I'll actually take the wrist, the whole elbow a little bit off so it's slightly softer, and you can just feel a bit deeper in that area there.
So this is more epicondylar.
No, this is
pronator. Isn't it?
Pronator. There we go. Really nice. Fibrous feel there. Good. Out. Through. A little bit of thickening there. That point there is really useful. Okay, so it's right there.
Okay.
Coming in at quite a shallow angle, trying to follow those fibres. Nice little twitch there.
Mm-hmm.
One more there. It's coming up a little. There we go. I never go down on that point. It's always fanning out. Away from there, up towards there. All very, very safe. Top point if you want. Yep, a little bit more there. Again, that's just as angled as I would ever go. Unless I've got the imaging on it. Good. Try that.
Mm.
Not particularly painful, is it?
No.
No. Treatment zone. Helps you to keep coming back so that you keep finding it, because you tend to slide off when you're shockwaving a little bit. Use the refocus shockwave. Catching the bone about there.
Yeah.
Keep it still. Move it gently. I tend to use a 12, 3, 6, 9 of a clock, so I find the epicenter. I'll move up a couple of mils into the 12.
And
I'll come back.
Superficial structure, so we're using the 5
mil, yeah.
5 mil.
I tend to do a 3 o'clock. Check in with the patient. Is that more or less?
That's more.
Okay, I'll hold there. Come back. 6 o'clock. Much there?
Not too bad.
Okay, come back 9 o'clock.
It's a bit more there.
Okay.
And hold on for up to 2,000 to 3,000 shots of this one.
Yeah.